All right, good evening. I am here to do the week 6 walkthrough and to also talk about your capstone project. So let me start by sharing my screen and let's get started. So you should be seeing the home screen, which has the welcome announcements on it. I did post a week 6 update because I'm moving content from week 8 to week 6 in the hopes that it will help you with your capstone project. And then as you can see, the landing page now is the advocacy and community organizing for y'all to make a difference. And so we will review this and go through the sections, go through the lesson, because I have the lesson posted now. So what we're talking about this week is community organizing and advocacy. That's been a big theme that we've been following throughout the course so far. And so how can we affect policy change? How can we make a difference? Can we advocate? What are best ways to advocate for, oh, excuse me, right, people or situations in our own communities as well? And so the things that we're going to talk about this week are going to help you be able to do that. Um, and we have built an awareness of what's going on, and we have collaborated, we're learning how to collaborate, and this lesson will help us with being able to take action and advocate. And so your voice does matter. So we're going to look at advocacy, which I think most people are pretty familiar with, using skills in your voice to influence outcomes to support people, to support somebody who maybe is experiencing a health disparity or is having inequitable care provided. And then we're also looking at community organizing. How can we build local power in our own communities? What are things that we can do in our own community to affect change? And then policy change. So a specific strategic action to improve community and population health. So is there some way that we can take what we've learned and what we're learning and what we're going to learn and actually affect a policy change? Like, who can we contact? Who can we talk to? Who can we build relationships with to do that? And so here are your required readings, 2 chapters, one from Mackenzie. It's a very good chapter. It was one of my favorite chapters in that whole book, is how to build a health promotion program and how to build community and community organizing to make a difference, to make a change. And then this chapter, chapter 9, inequality and interdependence, social problems and social justice, is actually a history of some of social movements over the last, I don't know, few years, few decades, I guess I would say. So it gives examples of what a difference you can make. Just small little changes, small little things can make big impacts. You also have some supplemental resources. There's an article to read. There is a link here that takes you to the Writing Center at University of North Carolina, Chapel Hill, that talks about how to write a policy brief, or if you're writing a letter or wanting to change policy, a good template to do that. And then this advocacy toolkit does the same thing. It gives you some templates and some ideas about how to format correspondence, emails, social media, things like that to affect a change and to advocate. And then your assignments for this week, your journal, as always. And then you're going to write an advocacy letter. So this is very similar to the advocacy intervention #1 that you did about the community garden and nutrition. And this one can be on any topic. We'll go over it in detail. And then, but you will actually be you write a letter. It would be up to you whether or not you'd actually want to send it to the representative or the council member or the senator or whatever. But you will do that, and then we will have a discussion that will center around advocacy and community organizing, but you will be talking about planning your capstone project. And so we'll get into those details in a minute, where you can help each other and provide guidance, thoughts, ideas, suggestions. That doesn't mean that everybody has to do something different. You can choose a similar or even the same topic because you may decide to choose different ways to intervene, or you may choose more of an advocate or policy role than a community organizing role. And then for your social justice journal, these are, please double check these, because these are a little bit different than what was originally posted. So make sure that you use the ones here from the overview page. So let us go to week 6, to that module. I'm in the student view, so this is hopefully what you see when you get there. And so we have what we just reviewed, which was the overview, which is your homepage for the week. And then let's look at, to turn in, you have the advocacy intervention, the letter. This is due by the 27th, so you have not this week, but this week and next week. Sorry, I need to plug in here. So you have a little bit of time there to prepare that. Although you can always turn it in ahead of time, that's perfectly fine. I just figure that most people will be probably haven't started their capstone yet, and so I want to make sure that I'm providing time for you to do that. And so when we're talking about advocacy, it's using your individual voice to influence a change. And so you're going to write a professional, persuasive letter to, it can be any public official, policymaker, somebody, school board, even community organization, to address some health equity or social justice issue that matters to you. And so you've done a lot of that research already in some of the assignments that you've done up to this date. And so hopefully that will give you a path to progress there. And then you'll talk about social determinants, structural determinants, and how to maybe do community-based change, like relating that in a real world context. And then you also want to propose a specific action or policy change, because you're writing about this problem that you feel strongly about. You're writing to, a council member, and you want to provide them with some solutions, or a solution to what the community sees as a problem. And so there's actually a template for that, and we will look at that. And so this relates to these particular course objectives. And so looking at disparities, strategies to improve the disparities by advocating, community organizing, or doing policy change. So this would be an advocacy piece, which could lead to community organizing or policy change. And then also demonstrating advocacy skills, writing a letter to a politician. As just the example that was chosen, you could, for your capstone, provide a policy brief or community outreach as well. And then here, the assignment objectives are that you will be able to communicate effectively about issues that are important to you in a professional as well as persuasive writing style. So I don't know if anybody's taken any communication classes, but often they have like debates where you're doing like a pro-con kind of discussion. And so in that way, that's what you would be doing here in this assignment as well. And then demonstrating civic engagement, so getting involved in your local government, some structure thereof related to a real issue, and coming up with a potentially real solution for that. So what you want to do is select a health or social justice issue that's important to you, something that we've already talked about, something that we might be going to talk about, something that we haven't really talked about but is really important to you. So you're going to choose that relevant health or social justice issue, looking at health disparity, inequities, something like that. Some examples that we've been sort of talking about throughout the course: mental health access, food insecurities, environmental hazards. That we studied environmental hazards, food deserts in the previous few weeks. And then it should be connected to structural or systemic causes of health inequity. So we could do better if only there was a structural or systemic change that occurred to make things better for everybody. And then you want to identify a target audience. So you would be writing your letter to one of the following, or something of your own choosing if it's not on the list and speaks to what you want to speak about. So a local or state policymaker, a school board member, community organization or nonprofit leader, a public health department or environmental agency, any of those would be fine. And then you will then proceed to research the issue. So you're going to gather some credible evidence. I'm thinking, I was trying to give an idea to come up with. So for me, being in the nursing and health sciences department, we do have a clinic available that we have been trying to get up and running that would serve students, like a student health clinic. And so I think that is a health and potentially social justice issue, because we feel strongly in the department that we should be providing, we have the resources to provide health clinic services. What we don't have is a medical director, physician to oversee it, nor a plan for how to staff it. There's a lot of regulations that go along with that. So let's take that. Let's say that's the issue that I wish to address, that there are students that have health issues that could be mental health issues and any issues, and that we want to what do we want to do? We want to open the clinic. We want to get the resources and open the clinic in the Nursing and Health Sciences Building O. So that would be my topic. And then my target audience, I could probably go to the school board and tell them, hey, this is really what we need to do. This is very important. We need your support. We could also go, which we actually have done, we could go to, for example, Natividad or Salinas Valley Health and partner with them and try to get them to help staff the clinic and help us with the rules and regulations that we would have to follow. So I could address the school board, or I could address perhaps the CEO of Salinas Valley Health, something like that. So that would be my issue and my target audience. And then I'm going to research the issue. So what do I want to know? I want to know, I would like to know how many community colleges actually have health clinics for the students on their campuses or nearby. And if so, how are they funded? Who runs them? Are they following the rules and regulations? And I would also like to find out, based on the student demographics, what particular health issues that are being seen in the clinic. So, for example, is it just colds? Is it allergies? Is it asthma? Is it high blood pressure? Is it diabetes? Is it pregnancy? Is it mental health issues? What are those types of issues? Because when I do my research, then I can look at those populations and say, oh, well, then we should have a respiratory, there's a lot of asthma or respiratory issues, we should have some of our respiratory therapy students there as well. If there are teen pregnancies, early adult pregnancies, providing counseling for those, maybe then thinking about providing daycare services for them, or on the flip side, also maybe providing birth control, different methods of birth control, those types of things. So I'm going to do all that research, look at news stories, look at local data, statistics, like we talked about, I think week 3. And why does it matter and who's affected? Well, our students would be affected because they have to then go to the emergency room or go someplace that will take them if they get sick, or if they, break an arm because they play baseball or something. And so the students are affected. So I've got all these ideas now in my head. And so now I want to draft a letter. Let's choose the school board. We'll start with the school board. I want to draft a letter, 500 to 700 words. That's professional letter, professional in tone. And in this letter, I'm going to include these components. So introduction, I would tell them who I am and why I'm writing. So, I'm a member of the Nursing and Health Sciences faculty. If I were a student, I could say I'm a student at the Hartnell campus who has asthma, for example, or who has diabetes, whatever the health concern would be. And I'm writing because I feel it's important that we have a student health clinic on campus. And so the issue is that there are students who are sick or whatever the research showed you. It's affecting students. It's affecting the graduation rates. It's affecting access to education, access to quality education, access to healthcare. Um, and it matters because they need to be taken care of, and we have the ability and the wherewithal to do it. And then I would, you can put in as many course objectives, course content, things that you would like to, and also cite your evidence, credible evidence sources. And then you talk about, or I would talk about, we all would talk about root causes, systemic issues using course concepts. So is there discrimination? Is it a funding issue? Is it, what are the root causes? Well, I mean, if you look at COVID, a lot of people got sick during COVID and many haven't recovered from that. Many people have, effects from COVID that have stayed with them, depending on what the health behaviors of this generation are. Are they smoking? Are they drinking? Are they drinking and driving? Are they, what education do they need? Teen pregnancies, um, sexually transmitted infections, things like that. When your research would tell you what you are seeing there, and so the root causes would be initially where we didn't have a space to have a clinic, nor a way to staff it. Well, now we have a space for it, but we can't. We keep being told, oh, it's too much money, or there's no physicians want to be the medical director. Previous college presidents haven't really wanted to support it. So the root causes have really been closed doors from administration. Would be one area. That'd be a root cause. And so the call to action, what do I want them to do? Like, be specific. Do I want them to meet with students? Is there some legislation that's coming through? Do I want them to fund a program? And so what I want them to do is talk to, again, we'll use Salinas Valley Health as an example, is I want them to meet with Salinas Valley and tell that, if Salinas Valley isn't able to provide physicians and some staffing and supplies, and also a patient base, it wouldn't have to just be students. It could be other people from the community that could come to the clinic. And so my call to action is for them to specifically speak with Salinas Valley. And if Salinas Valley doesn't care to join and collaborate with us, then I want them to go talk to Natividad, and to sell it, so that we don't have to pay 100%, like that we split 50-50 the cost, because there's got to be a win-win kind of situation there. So that would be the call to action. And so in closing, then I would restate what I had stated, what I would like them to do, and then not in the letter part, but you will identify resources that you used. And then after you've completed writing this letter, you're going to then write a reflection about what you just did, the whole process that you went through. How did the process help you understand advocacy, power, and your role in creating change? So that would depend on how you felt about the issue. So being able to advocate for a person or a group of people is really, to help empower people. Maybe you would do, you're writing to the school board, but you want them to also speak to students and find out what students want, find out like what hours would be good to be open, or the issues that are important to them. And so I learned that a lot of times we can all have great ideas, but if we don't have buy-in from everybody, from admin, from the people that have the money that write the rules and regulations, then it just sits there and nothing moves forward. And then depending on the response, can I as one person create change? I don't know. That would be really cool to find out. I think sometimes we kind of stick our toe out, a little bit and test the waters. And once we do that, things just take off more and more. Maybe there would be other steps. This would just be an initial kind of step. And what does it feel like to take that step to advocate for something that you believe strongly in? There's no requirement to send the letter. It's just an opportunity to demonstrate one way that you could advocate for an issue about which you are passionate. And then this is the rubric, which is 25 points. And so that tells you how to, it's very similar to the other advocacy assignment that you did. And so that is how that one goes. And then if we go back to the module, for week 6. Week 6, we will turn to the discussion. So again, we're looking at the assignments, and then we'll go back and look at the lesson because that will help. And so the discussion has to do with your planning your capstone project, having to do with advocacy, organizing, and health justice. So there is a link here to the actual project itself. So if you need to refer to that, I'll click on the link. This is also a good way to check and make sure all the links work. And so this is the assignment, tells you what objectives that it meets. You can choose to meet it in any different formats. Excuse me. Let me review this and then we'll go back to the discussion because this is what the discussion will be about. So trying to think. Okay, and so you could write a paper, you could do a presentation, like maybe you would if you take your school board example, maybe that will give you some examples, or the community garden idea, or any other ideas that you have. You could write a paper, you could do like a PowerPoint or Google slide presentation or some other type of presentation. You could, for example, write another letter and a policy brief to a council member, to school board, something like that. Or you could have some other creative way to make your point. You could do like an infographic. That was an assignment that we had, I think, in week 3. You could record a podcast, a video that includes a written explanation of how it's meeting the objectives and the pieces, the components of the project. So what you want to do for this, and again, it's worth 100 points, and make sure to follow the rubric as well, is what is the issue? What's the public health problem, the affected population, and the social determinants or structural determinants. I could probably add that in there, social or structural determinants of health that are causing this. So it's very similar to the letter that you wrote in the assignment. And what is the organizing or advocacy strategy? Have there been other past or proposed community organizing efforts or advocacy strategies? Or is this something new that you're planning or that you think might work? What is your role, or the plan? Share how you would take action. Are you going to organize an event, speak at a council meeting? You can speak in front of city council meetings. You can speak at board meetings. What is going to happen there? What's your plan? So if we take our issue being, again, this is not the best issue, but if we take the health clinic, the student health clinic, that would be the issue: lack of access to healthcare, lack of access to quality healthcare, and then what there really haven't been any efforts. It's mostly been at an administrative level, but maybe if students also participated and asked for this, that might carry more weight, or it would make it more personalized. And so that's kind of the strategy. I want to bring in more students to help support this idea, if this is something that they want. And then what am I going to do? So how am I going to take action? Am I going to, I think maybe I would do, depending on my audience, if I want to get the students involved, because I might want to do that, I might do a social media campaign for that portion. And then if I want to involve the school board, I may want to speak in front of the school board. I'm not sure they're all on social media platforms. And then when I'm thinking about how I'm going to put this together, what are the barriers and equity considerations, right? Because that's what the class is about, social justice. How are our students, and we are a Hispanic serving institution, so, and the majority, you can look at our statistics, the majority of our students are Hispanic students, but we also have small pockets of Pacific Islanders, Asian population, we have Filipino, trying to think what else, besides Caucasian. So we have marginalized populations of students who are continuing to not be served by what is known as a Hispanic serving institution. And so I feel like we're not meeting those needs. We're not addressing it. We know there's an issue and we're not doing anything to address it. And so I think that would be a barrier that would be part of barriers or equity considerations. And so what I want to do is I want to have students become involved. I want students to come to board meetings, to rally, to maybe the students talk to the CEOs from the hospital, something like that. But I also want, again, our board members to speak to Salinas Valley Hospital, that kind of thing. And then what you're going to do is kind of put together like a letter. If I'm writing the letter, then I would write a copy of the letter. Now understand that the letter that you write for the advocacy number 2 assignment cannot be the same letter that you use for your capstone. It has to be something different. It can be similar, but it should be something different. If I was going to speak at the school board meeting, then I would write a script. I would write something out that and turn that in of what I would say, what I would read at the board meeting. If I were going to do start a social media campaign with to pull in students, then I could record a reel, a 3-minute reel, or I could do something like that would go on Instagram or TikTok, something like that. Or if I were going to post flyers or something, then I would include the flyer. So something that's going to physically, it's called a skill demonstration, but something that is showing how I'm going to advocate. And then sources include at least 3 credible sources, and including at least 1 community-based or local resource, and that should be cited appropriately in APA or MLA format. And so, what ideas are there? What things can we talk about? Where are we seeing things? So these are just some suggested topics. There's a link here to another long list of topics. Environmental justice. Are there any environmental issues in our area? It doesn't have to be in our area. It would be nice if it would be in our area or wherever you are located, but it doesn't have to be. Is there housing instability in health? We do have a population of students who are houseless that are attending Hartnell College. Mental health issues, LGBTQ, healthcare discrimination, farm worker health and pesticide exposures, immigrant access to care. It's a whole list of immigration issues that are surfacing at this particular point in history. Any particular community violence or trauma that's occurring. Any of those ideas or anything that we've talked about, ideas that sparked interest or from your readings, anything like that are all good ideas. And then this would be the rubric. The points are over here. Sorry, not over there. And then that adds up to the 100 points. And so you would upload your paper presentation file. So remember, you could choose to write a paper, do like a PowerPoint, write letters, or some other type of creative project with a written explanation. So what you will turn in is you upload the paper or the Google Slides, or the letters, any of those type of thing by the due date. You also need to include, for example, if you do like a social media campaign, there has to be some short written explanation of why you're doing what you're doing. There has to be evidence of all of these things in what you turn in order to earn the full points. It is a little open-ended to give you the creativity to create a campaign like this. But hopefully you will find something about which you're passionate, and it will move you to want to make a difference. So having gone over the components of the Advocacy Capstone project, let us go back to the discussion for this week and see how that might be helpful. So the project is worth 100 points, invites you to research a real public health issue, develop a creative evidence-based plan to promote health equity through advocacy, organizing, or policy change. And then this week's discussion, worth 20 points, like all the discussions in this course. And so this is designed to help you to begin or continue to shape the ideas, get feedback, clarify your direction. And the more thought you put in now, the stronger it will be. And this is also a way for you to reach out to each other. You have the Google Chat if you want to speak to each other offline outside of the course. That's a good avenue for you. You can message somebody there. There is also a link to a Google Doc template that could potentially help you organize your discussion as well as your project. Note that it will take you initially to make your own copy because it is a Google Doc. And so I didn't want students to mess it up for other students. So this is like a planning template, for example. So, the issue, the focus is all there. What are you going to, what format are you going to choose? What kind of different strategies are you going to use or think about? What are some challenges or those barriers, equity, social justice connections? And then what are you still unsure about now as you've talked to other students, as you're thinking about this, as you're thinking about moving forward and reviewing the things that we've gone over the past 5 weeks and what we're learning this week? Are you still unsure about something? What kind of supportive feedback would help you to move forward? So from the point of where you are right now, in what ways can we help everybody to move forward in this and it's basically tying everything together from the course. So again, going back to the discussion, excuse me, it's basically going through that template, that rubric. So, what issue or population are you thinking about? Which one, is important to you? What forms? You're going to do a paper, presentation, and again, make it easy on yourself. A lot of times I get very excited about things, and so I tend to spin a lot because the ideas just keep going around and around. So once you decide on something, take that path and work it through. I know many of you are taking more than one class this summer, some even 3 or 4, which is a lot of work. So, be complete and thorough and thoughtful with this, but stick to the plan. Are there, what strategies are relevant to your issue would you like to use? Any challenges, the barriers that the population faces, you unsure or need support about right now? So basically that's what that template that I just showed you, that Google Doc, is helping you to format your answer for the discussion and also to put your ideas down on paper for the project. And so you do your initial post, and then you're going to reply to 2 peers and encourage them, give them suggestions. If you have resources they could look into, connections, things that help each other, help each other out. For this particular discussion, there is not a specific date that the initial post must be completed by, and then students would reply by certain dates. The initial post and the 2 responses are due by the due date, which would be this coming Sunday, so that people can be working on these things. So these are the objectives that are met with this. The due date would be Sunday, July 20th. Let me know if you're really tight on time. We could maybe push it out a couple days. But you can post everything on the same day if you want. It doesn't have to be throughout the week. It's very open that way, whatever works for you. And so you need to answer all 5 questions that are asked above, share your thoughts, encourage, references, think about the lessons that we've had so far. And then, again, with the peer replies, and it's fine if multiple students are focusing on the same topic, not a problem. And so that is your discussion and the advocacy capstone project. So let's go back to the module, week 6 module, and see what we have completed so far, right? So we talked about the advocacy intervention, the discussion, we talked about the capstone project. Let's look at the journal, and then we will go up and look at the lesson for the week. So the social justice journal, I moved everything around so things would match. So you will have to do that in your journal template. And so this is the journal, and the prompts have to do with advocacy and community organizing. So remember to talk about key concepts or definitions for these things. And from the lesson, you will have definitions of these terms, and then answer. Those are not the right questions to answer. I just realized that. So I will make those the same questions from the overview. I will do that. And then 10 points. Students are doing well. You could go a little bit deeper in your responses. Make sure to include pictures and links. things that would almost even make it like a study guide for you. You will find as you are preparing for your capstone now, if you go back through your journal, some of those ideas and things that you talked about might be pertinent, might help in that project. So I will definitely update those to be the same as what's in the overview. My apologies for that. And then let's go back one more time to the module and look at the lesson. So the lesson for the week focuses on advocacy, organizing, community organizing, and policy, tools for health equity. So how can we be advocates and help establish health equity, decrease health disparities, and promote social justice? So this particular lesson is divided into tabs. And so there are 4 tabs with 4 different topics. So we'll just start with one and move our way along. And so we start with public health advocacy movements. So what are things, I think Black Lives Matter, that's probably the most recent one that probably comes to mind. I'm sure you can think of others, but there are, when we talk about health and health inequities, social justice, those types of things, it's not just something happening in a clinic, for example, or in a hospital, right? It's things that are happening, as we've seen, with social determinants of health, with structural determinants, with all those different kinds of things that come into play. And so it just isn't a modern world thing. These things have been happening. There's been inequities throughout history. And so I wanted to start by going through the history, not every single thing, but some different movements that occurred throughout history that you might find interesting or that might help you design your own advocacy campaign. And so, what makes it a movement, right? Gosh, I don't know. It's something that's very real and lived, a lived experience that people are going through. It is community voices. I have in my growth and development class right now, there is it's called the We Do Not Care Club. I don't know, you probably haven't seen it. She's on, the gal Melanie Sanders is on Instagram, Facebook, YouTube. She's like on TikTok, all these platforms, and she is has started going through her through perimenopause, the time that happens before you go through menopause, and she just is experiencing all these symptoms. And so one day she just was in her car and she started talking about, all these symptoms and things, and that her husband was kind of not understanding, and she just had brain fog, and and she's like, I don't care if I look like this, if I'm wearing sweats all day. This is how I feel right now. And so she actually developed something, or created something called the We Do Not Care Club. And we do not care that our hair is messy. We do not care that we don't have makeup on today because whatever's we have, we're hot and cold. We don't care that we have the heat and the fan on at the same time, because that's just how we feel. And she was no, not a blogger. I don't know. I guess you could call it I don't know all the terms, sorry. But she had, some followers. It was pretty cool. But when she started talking about menopause, it like flipped a switch for people. She has over 1.5 million followers just on Instagram right now. And she has she calls it the We Do Not Care Club, and there are people from the UK, England, Scotland, Ireland. There's people from all over the United States. There's where did I see somebody from not Africa, where, I can't remember, but like all over, right? All over the world, there are people that have put in their applications to join the We Do Not Care Club. This is a movement. It is community voice. It is her lived experience that she is sharing and bringing the community of women that are entering perimenopause, experiencing menopause, postmenopausal, having this lived experience. She tells a story while she is doing this. Everything that she says, she wears, 3 pairs of glasses because we all can't see, and her neck hurts, and she's got a little neck thing, and and then she has this list because we can't remember anything. We all have brain fog, and so she's got a list, and she checks everything off as she goes, and it's storytelling. It also, makes us think about what are we what are we experiencing as we go through perimenopause, in our 40s, 50s, 60s, I guess you would say, in the perimenopause, menopausal stage, season of life. And hot flashes, for example, that is science-based. And so there have been many discussions and many posts for her videos that talk about, well, I do this for my hot flashes. Have you tried this um, treatment for hot flashes? Or excuse me, the brain fog. What do you find? What are your doctors telling you? What research have you done? So there's actually that in there. And then um, I don't know, strategic pressure, but pushing for long-term structural change, not just quick fixes. It's really been enlightening for partners, friends, people that know people going through perimenopause, menopause, and postmenopause. So it's like her husband did not understand. She tells you that on her posts, on her videos. And she felt that he did not get it. And so now he gets it. And so does the rest of the world who didn't understand it. And so I think that even in and of itself is a structural change, in shifting the way that people think about and understand menopause, the whole pre, during, after menopause. So when we talk about a movement, it could be something just as simple as that just takes off by one post. I just thought I'd share, and poof, it just took off. So when we look about through history, in different parts of the centuries, and we talk about environmental justice, for example, 19th century sanitation, very unsanitary conditions. We didn't have sewers. We had outhouses. We didn't have plumbing, those kind of things. And people like Florence Nightingale advocated for clean water. They realized that if you didn't have clean water or places to separate out your trash, if you will, that people would get sick. And so especially Florence Nightingale, she, you know, came up with standards, actually standards of nursing care, that led to health boards and laws, and indoor plumbing and different things like that. In the mid 20th century, disease prevention and health access. Tuberculosis was a huge thing. Tuberculosis is very contagious, but we can test for TB. There's medications we can give for that, but we didn't have that, and people were dying. It would spread, and people would die. And so civil rights activists, reformers really pushed for, as well as maternal infant mortality, workplace safety. Nobody cared. You worked whatever age it was. There were no safety standards. There was no OSHA. And so many people got hurt and died. And so because these activists, for example, the March on Selma in 1965, and talking about segregation and disparities, basically inequities and disparities, helped to establish Medicare and OSHA, and some community health centers. So people got an idea, they realized it's not fair, they spoke up, and now we have OSHA as a safety net, providing us with standards. In the late 20th century, talking about different rights-based health movements. So, for example, having to do with HIV/AIDS, especially in the early 80s when that was first coming about, reproductive justice, looking at environmental justice, some of these things that you've actually looked at in your a natural causes, one of those assignments, and disabilities, Americans with Disabilities Act. People felt passionate and driven to equitize the field, that people were treated and got care. So if you look at what's the movie Philadelphia with Tom Hanks, that was an early either late 80s, early 90s movie having to do, Tom Hanks had HIV, and which eventually led to AIDS, and he was fired from his job for that. Now he was Caucasian, but he was also homosexual. And so that is a marginalized group. And so that movie dealt with that. But that was the entire 80s was about that. Moving into the 21st century, intersectional and global advocacy. We're going to talk more about global health in week 8, is where that was moved, but health equity language, like we actually have terms now, health equity, social justice. We use those terms. We look at social determinants and structural determinants of health. And so there's just some different, the Black Mamas Matter Alliance for maternal health. The African American Black women are historically receive poor quality prenatal maternal care. There are studies that show this, and so they and their babies have poor outcomes. And so there's policy campaigns that happened. Just even doing studies, we're now aware of it. We teach it in nursing, and we, many nurses, at least nurses that I've seen, I've worked with, it doesn't matter. Everybody gets treated the same, and the nurses will actually advocate for their clients, and they will push physicians to do certain things. And we have standards of care, so it doesn't matter what you look like if you are pregnant and having these things happening to you. This is the standard of care that is expected. And then there are some, I just put more information about some of these specific recent public health advocacy movements, and then even looking at things in our own area. For example, Monterey Bay Economic Partnership. There is like Salinas Valley Health and Tivadad. They have specific programs for different ethnicities, different people, different health needs, mental health, those kind of things. So these are some local places that promote advocacy for particular health issues. And so things that you can take away from this is, using advocacy as a public health tool, right? Because this is a public health class. This is health and social justice, and movements, these changes that happen could start with you. It could be one of you that gets a movement going. We look at history. It gives us a way to look at how to advocate, how to organize, how to change policy. And it also helps us look at how power and health are interconnected. So thinking about who gets to speak, who decides, that determines who could potentially be healthy or not. And so if we advocate, then that helps to redistribute that power more fairly, more evenly. And you can be a part. You can learn about it now, and then as you move forward in your path, you can make a difference. So that has to do with just understanding and becoming passionate about we can make a difference. So then what exactly are the definitions? What's advocacy versus organizing and policy change, right? And why does it even matter? They overlap. They're all promoting something, changing, making things better, equity. But they have distinct approaches and goals, ways that we approach them. And so there are some tables here talking about advocacy, again, where you're using your voice and influence to promote a cause or policy. So individual or group of people. So for this example, they say writing a letter, which is something that you're doing in your assignment. But advocacy could even be like one-on-one, like if well, we could use maternity because that's my background. If I feel that the physician provider isn't listening to what the particular mother in labor or for her prenatal care, the questions or concerns that she has, I will advocate for her. I will go to the physician and say, hey, she has these questions. Can you please go back and talk to her? Can we work this out? Can we get her this, or this? That's an advocacy component. Organizing is the community piece, community power, creating change, bringing people together in the community, often over time, not something that's going to happen in the moment. And putting, people having a shared experience. And then policy change, some way to create, change, enforce laws, rules, practices that address structural determinants, right? The structural policies. We talked about that early on. We talked about social, and then we talked about structural determinants. And so if we can, have a law or ordinance, something passed that will be helpful, that would be a policy change. And so they do overlap, but they do reinforce each other. And so then this just gives you more specific definitions of advocacy, gives you some public health examples, things that are strengths about it. You can do quickly, can be in the advocacy in the moment. It does help to enlighten people about health issues. And in this one piece that I do, it builds momentum. I can do that for more and more and more people. But it may not build long-term power because sometimes it is just in that moment. And if the community doesn't get behind you, then that can be a limitation. Community organizing, again, is a longer term process of the community coming together to solve a problem. And so the key features are there, public health examples, and then the strengths, long-term community leadership and relationships, collaborations. You can often have larger structural changes take place, which are helpful, helping more people over time, and helps the community to feel empowered. However, it takes time and it takes resources to build and plan, especially to be a good planner. And sometimes it's not something I myself can do. I might need facilitators or some connections, leadership, or community connections to move things forward. And then policy change, right? Changing laws, regulations, could be policies. Even in like nursing and health sciences, we have a policy and procedure manual. Students have input into that. So we've had students that have brought up, we don't want to wear all white nursing uniforms. We don't like that you can see through the white. So we actually changed the registered nursing pants to black. That was a student change a couple years ago. And before that, they had changed vocational nursing to burgundy. So students have a voice, so that they were advocating for themselves. They got together as a community of students, came to our policy and procedure meeting, and then effected a policy change. And so that can happen at any level. It's helpful to have data to make that happen. Could be a legislative, like at a state level, a federal level, or could just be a local level. There's some examples there for you. You know, the change can last. We have black pants. We have black pants. We're not going back to white at this point. Can address root causes of health disparities. It can redirect public resources to you know, which direction. If we have more issues for, in this example of mental health, we'll go that route. But it can be slow, it can be bureaucratic, political, because we're dealing with a structural determinant and a power determinant. And so you have to sort of just keep chipping away at it. They do work together. And so these are some examples of how they work together. And then it provides you with a summary table again at the bottom there. So that in a nutshell is the similarities and differences. Then if we specifically look at community organizing, you know, why are we looking at different models of health? What does that mean? Well, change happens in different ways, and there are different models to support change. And talking in terms of an individual making a change, or having not community, but not even really a system, but like more levels to help. It's not just me. I have support on different levels to help me make these health changes that I want to make. And so when we talk about socio-ecological model, that really sounds like a social determinants of health type model, right? And so how personal, social, environmental, policy level factors all interact. And so on an individual, interpersonal, community level, and so they give the example here of obesity rates, right? Youth obesity rates. It's who we say, oh, look at that teenager, they're fat, or whatever, or you know, this particular ethnicity or race, they're always heavy set. But it's not just that person, that child, right? There are other factors, socio-ecological factors that feed into that particular situation at this time. So youth obesity rates can be influenced by the individual, the child themselves, by the family eating patterns, by where are the grocery stores, where do they get food, where do they get their groceries, economics, can the family afford the food, are they in a food desert, is there a school food program, school lunch and breakfast program available, are there places to exercise, do they have access to federal and state programs, And so that would be the socio-ecological model where there's many factors related to the health of one person. And then this also shows you that this is how the social determinants of health can feed into that as well. When you talk about community organizing, right, people come together, it's a community thing, but you have to make some assumptions, right, if you're going to have this be productive, right? So people in the community have to want to participate in changing what's going on in their community. And a lot of times people are just like, oh, it's okay, it's all right, I'll deal with it. So they have to want to participate. They hopefully have some existing strengths amongst their members. We want to be able to pinpoint those, and then we want to be able to expand and build new skills for them. It's got to come from within, right? Not just you saying something and people doing it. Like, they have to believe it and want to own it to make the change, not just from outside interventions. And then it's very relational, right? People within the community have relationships. It also has to be strategic, because you have to figure out, okay, I'm going to build this relationship now. We've done this little building here and we've built trust. Okay, now we're going to move over here and talk to these people and make this happen and build trust and collaboration and keep moving on. So organizing isn't like charity or rescuing. This is a little statement I thought was interesting. It's actually a power building process that centers on the community voice. It gives power. It empowers the community to have a voice and speak for itself to promote equity. And so there are different models, community organizing models. You can do planning and policy practice, so influencing like the school board, like we talked about earlier, and we would use data, resources, credible resources, and then advocating for a local tobacco sales ban near schools. That might be an example of that, where you are influencing a specific institution. You can also have something called capacity development. So building skills and leadership within the community where there is training or mentorship, leadership roles, those kind of things going on. So you are taking someone who has the potential, the capacity to has I want to say has the existing strengths, and you're going to play to those strengths and build on their strengths to give them a greater capacity to organize and to make a difference. So could be in this example a youth-led mental health campaign that trains peer educators. So there's training that is going on. The mental health campaign is there, is forming, is there in its infancy, if you will, but we are training and we are increasing the capacity to make a change. And then social advocacy would be another model that's used, and so which kind of falls under the social justice piece, confronting the injustice and demanding a systemic change, direct action, protests. We have seen a lot of protests lately, media campaigns. So that would be social advocacy. For this example, farm worker marches, where they want shade and water and breaks under the California heat law. So they may overlap. These are just different ideas. So you could use these ideas when formulating your capstone. There are also things known as needs-based versus strength-based approaches. So if it is needs-based, then it would be focused on where there are gaps or deficits. The particular population needs something. There's a gap. There's a deficit. They don't get breaks. And then oftentimes that will come in if you think like a union would kind of be like that. So for example, if the pay isn't equitable, there's not like a specific scale, you just sort of get paid whatever. The union will come in, that's led by outsiders, and might reinforce the negative narratives, the anger or the negativity between the employer and the employee kind of type thing. But that's like a needs-based. So a needs-based approach might list what are they saying? High obesity, low graduation rates. And so that's why we want to decrease the obesity, so we have higher graduation rates. Strength-based based approaches would be that focuses on assets and capacity. So that would be what we were just talking about, the planning, and especially be the capacity development, right? We're focusing on the assets. We're going to build internal leadership, and then encourages empowerment and agency of the person and the group. So that's probably the better way to go there. So strengths-based approaches, like you were talking about a community gardening project or community garden project, that would be a strengths-based approach. And then when you think about community organizing, if this is the direction you would like to go, there are steps. So recognizing the issue, you kind of have to then, if you see what the issue is, you have to sort of gain entry into the community. Now you might already be in the community, so that wouldn't be a very difficult step there. And some examples are given, different examples are given. And then who are the leaders and stakeholders? So if I'm going with my issue of needing the student health center, I've recognized that as an issue. I've done a little bit of research on that. I already have entry into that community, other than the fact that I'm not a student that is experiencing it, but I have access into the community. What I need to do is gain entry into the student part of the community. Leaders would be administrators and at the hospital and at the college. Stakeholders would be students, or would be people maybe where we're getting our supplies from, something like that. And then what are the community capacity? What are people in the community able to do? What do they need? The needs-based versus strengths-based approaches. And then priorities and setting goals. And that's what this last part of the lesson will be about, is goal setting. What matters most? Yes, we want to get that clinic going, but we have to have certain things in place before we can see our first patient. And then which strategy are we going to use? Are we going to do or combine? Is it going to be advocacy, policy change? I'm thinking probably community organizing would work well for that example. And then we implement and mobilize. So we come up with our priorities, we have our goals, we decide what strategy we're going to use, and then we make it happen. We put it in place, we activate the people, we do events, we do whatever it is to keep the momentum going pretty much until we get some kind of resolution. We meet the goal or get close to the goal that we set. And so that's part of evaluate and sustain the efforts. What worked, what didn't. If it worked, let's keep doing it. If it didn't, let's think of different ways to make it work. And so this was an example of supporting undocumented students on campus that walks you through the steps. You guys can look through that. And then the health promotion program cycle. So in terms of putting together health promotion program campaign, you have to gather information. You have to do a needs assessment. Is there a need for a health clinic on campus? Are there specific goals or objectives that we want to have? We would like to see maybe I don't know. If we polled students, we would like to see that at least 50% of the students polled knew that we were going to open a health center within 2 years, something like that. Or that once the health clinic is open, that we will see at least 10 students per day. And then what intervention strategies, how are we going to get there? Then we implement, and then we evaluate and reevaluate to re-implement. And so then it gives you examples of like what's a best practice, best experience, and best process. Those are things that you look at. You want to look at any research. Have people done this before? What's worked? What hasn't? Are there case studies? That's where we're kind of going over some case studies in this class as well. What kind of worked in a real life scenario? Can we extrapolate that to our scenario? And then, best process. Is there a specific process that works? And I think that, checking out the needs, setting goals and interventions, and then implementing them and evaluating, I think that's a great process to use. And then this just reviews what you'll take away from this piece of the lesson. And then the fourth and final piece of the lesson for week 6 is the SMART goals and evaluation. I wasn't sure that students knew, I think students all know how to set a goal. We all know, what a goal is, but what is a SMART goal? That would be the best kind of goal, especially when we're talking about putting a program together. And so you can set that, but we want a goal that is going to be specific, measurable, achievable, relevant, and what we call time bound with a time frame on it. And so this will help us when you're doing your capstone. So when talking about SMART goals, there's a little video here that you can watch. We've said that it's specific, measurable, achievable, attainable, relevant, and time bound. This is a little practice here that will give you some goals, and then you can, it should, I believe, oops, take us somewhere. Yep. So I can show you. So improve access to mental health resources in our community. We'll define what is improve access. What is it currently? What do we want it to be? What are there specific mental health resources, right? Define community, and when do we want to have that happen? Like within 6 months, within a month, within a year. And so this activity helps you kind of refine some of these goals into actual SMART goals. And so why does that matter when we're trying to advocate or organize within our community or affect a policy change? Excuse me. It will help clarify what the purpose is. It will give us some accountability and how things are going to impact everybody that's involved in the process. And then evaluation is really important because, you know, did the process work? Did the way we do it, the way we planned it, did that get us where we wanted to go? And then there's also the outcome evaluation. So was there actually a change? Did we get you know, all the rules and regs put together and so that we could actually move forward, for example, with the clinic? There are different ways to write SMART goals, SMART objectives. The objectives that are written for these courses are not, I mean, we say by the end of the lesson or the end of the course, so that would be a time frame. They should all be achievable because we're teaching them, but those are what SMART goals are. And so multiple approaches, ways to explain it, gave you some different examples here. You could say who will do what and how will we know by when. So for example, going back to the Dreamer students, the students in the Dreamers Club will organize a Know Your Rights workshop, resulting in 50 undocumented students receiving legal and health access resources by October 15th. So that is specific to who and what, how we're going to measure it, the 50 students, and then there is a time-bound date, October 15th. So, and then you can also write it, you know, by November 1st, the students or the Health Equity Club will hold a listening session, resulting in a summary of at least 10 ideas, actionable ideas, things that you can actually do to address food insecurity. You could also say by, you know, using the date by when 100 students will have completed the peer-led workshop on racial disparities in maternal health. That's a great one. Or for example, measure includes who, what, and by when. So 3 letters of support from local policymakers advocating for the mental health funding will be collected by October 25th. So those are all different ways that you can write that a SMART goal. I prefer the first one, but the other ones are all acceptable. And then here are some more resources. This is an article about writing meaningful SMART objectives. And then these are just like some practice templates that can help you with how to word that. There isn't anything specific to the campaign project that says you must have 3 SMART goals. But in order to evaluate, you need to have a goal because you need to know, did I reach the goal or not? And so that's basically the lesson. So if we go back to the module, it's a lot of information. Hopefully you're hanging with me. We're just about done here. So we went over the overview. We just finished going over the lesson. We talked about that advocacy intervention, writing the letter. We went over the discussion, which will help you with your capstone. We reviewed the journal. I have to go back and switch out the prompts so that they match the overview. And then I added the capstone project to week 6, 7, and 8, just so it's there on your mind to remind you when it's due and that it is due. I very quickly wanted to show you that week 7 and 8 are open. If you go to week 7, the overview and lesson are there, but they are not complete. I have the overview for week 7 is pretty complete, but the lesson is not. However, the assignments, because students had asked through that anonymous survey, they wanted the assignments out all at once. So the assignments for week 6, 7, and 8 are all posted. And I'll make sure that the Social Justice Journal make sure that all works. Current public health issue, just as you did already in the first one, and another case study analysis similar to the food one. This has to do with violence and criminalization, drug use. So those are there. And then week 8 is talking about health on a global level, global health, U.S. responsibility, and also looking at, when we talk about global health and U.S. responsibility, looking at infectious and chronic diseases here at home as well as abroad. How does that fit into global health? And then there's a discussion there, and 2 assignments there, and your social justice journal and your community organizing capstone project is there. So I did want to show you, again, the overview is somewhat complete. The lessons are not yet complete, but you have the assignments there. And then I'll do walkthroughs for week 7 and 8, going through the lessons as well. And I think that was it. So you all know how to get a hold of me if you need to get a hold of me. And so please reach out. Several of you have, and I really appreciate that. And if you have questions, let me know. I'm looking forward to hearing your discussions. I think that will be very helpful. And I hope you all have a great week. All right. Have a great evening. Thank you.